Dear friends, welcome to my geriatric medicine channel. I am Dr. C.G. Keshwamurthy from Shumaga, a geriatrician. Let us know something about cancer in elderly people. Why cancer is more common in the advancing age groups is a main question. Cancer is one of the 5 most common causes of death in elderly Indians. Age is the strongest risk factor in the development of cancer. Though the relation between cancer and aging is unclear, increased risk of cancer in old age is possibly due to many factors like poor cellular repair mechanism, activation of genes that stimulate cancer, suppression of genes that prevent exposure to carcinogens. Longer life allows longer exposure. This is very important. Longer life allows longer exposure to environmental factors that are likely to produce cancerous change in the cells of the body. I repeat, longer life allows longer exposure to environmental factors that are likely to produce cancerous change in the body. Why? What type of cancer is more common after the age of 50? There are certain cancers which mostly occur after the age of 50 years. These include head and neck cancer, lung cancer, cancer of the female genital tract, upper and lower gastrointestinal tract, pancreas, and prostate. Half of the breast and blood cancers are encountered after the age of 60 years. So, all these cancers occurs after the age of 60 years, 50 years. They start developing after 50 years. Is cancer infectious and incurable? Is it incurable disease? There is much confusion and myths about cancer. This should be discussed first so that the older people adapt a sensible attitude, positive attitude towards their health and seek appropriate help if need arises. Cancer is not always fatal. One should remember this statement. Many types of cancer are now treatable and others are becoming treatable also. Early detection means a better chance of survival from the disease after the treatment, of course. Cancer is not infectious. This is very important. Cancer cannot be caught from the contact with a person who has the disease or from his belongings or family. Cancer is always painful. Someone with cancer may have other signs and symptoms also, such as vomiting, bleeding, but no discomfort or pain at all. Cancer at the early stage is not painful, but later when the secondary infections and the ulceration takes place, it becomes painful. And in the case of intestine, when the obstruction takes place, pain arises. What are the warning signs of cancer? Dear friends, there are certain warning signs which may point to a cancer. Change in the bowel and bladder habits. A sore that does not heal properly or quickly, which we expect to heal within 15 to 20 days, it won't heal at all for a prolonged period. Unusual bleeding or discharge from the orifices of the human body. Thickening or bump in the breast or elsewhere. Indigestion or difficulty in swallowing. Obvious change in the wart or mole. If the wart which is present since so many years, if it becomes bigger and it starts to ulcerate, then one has to take care of that immediately. Nagging cough or change in voice is also a sign of cancer. Of course, when all the treatment is given to that patient with nagging cough, even then it is not relieved. If not relieved, then only we should consider cancer and investigate accordingly. What are the current recommendations for cancer screening? True consensus has not yet been reached for all tumor types, but general guidelines are as follows. Breast. Breast self-exam monthly from age of 20. Physician breast exam annually from age of 40. That means after 40, a physician or a lady doctor should examine the breast of the lady. Mammogram every 1 to 2 years is a must, starting at the age of 40 and annually starting at the age of 50. So, self breast examination and then the examination by the doctor and mammogram frequently will reveal if there is a cancer. Then colorectal cancer. Annual physician digital rectal examination age of 40. Annual fecal occult fecal occult blood testing is important. And that means fecal occult blood means if it is not seen in the stools, but when it is subjected to laboratory test, occult blood hidden in the stools will be revealed. Uterine cervix. Cervix is the major organ in elderly female which undergo cancerous changes. Annual pap smear and pelvic examination starting at the age of 18 to 55 is important. Interval may be increased to every 3 years after 3 negative yearly examinations. Prostate in males. Annual digital examination and serum phosphate prostate specific antigen PSA, serum prostate sensitive or antigen. Its level determination starting at the age of 20 is very important. In case of lungs, routine chest X-ray or sputum cytology for chronic smokers is important. Skin, complete skin examination for population at risk who has got a family history. Increased sun exposure like laborers, presence of precursors of lesions, and those people should undergo frequent testing by the appropriate doctor. Orally, physician gloved examination of the oral cavity routinely is important. For high risk patient, it has to be done. Population. Only tobacco, alcohol use, presence of precursor lesion, all those people should undergo screening tests. Dear friend, this is about, of course, in brief, about cancers in the population, especially elderly population, who have to take care of many precautions during the development of cancer, and early diagnosis is very important. Dear friends, thank you very much for patient listening. Please subscribe it, like it, and share it among your friends. Jai Bharat, Jai Karnataka. Thank you very much.